we will review the pathophysiologic implications of non-cystic fibrosis bronchiectasis, or NCFBE, including the effects of persistent neutrophilic inflammation. We also assess evidence and guideline-based diagnostic measures that can successfully identify patients with bronchiectasis, and we'll analyze clinical trial data of emerging therapies that target the inflammatory component of bronchiectasis. So I will begin with the discussion of the pathophysiologic mechanisms of non-CF bronchiectasis. First off, let's just say a brief word about the epidemiology of bronchiectasis. A recent estimate is that there's between 340 and 522,000 patients in the United States with non-CF bronchiectasis. About 2/3 of these patients are female, and about 3/4 are 65 years or older. There's clear evidence of an increasing incidence and prevalence of the disease. In a paper that was published several years ago, it showed an 8.7% increase per year between 2000 and 2007. And we believe that that incidence and prevalence continues to increase on the same trajectory. An interesting study recently was published, which looked at the data from LCAP, which is a large group of patients who underwent low-dose CT screening for lung cancer in the New York City area. And actually, in this study, the purpose of which was to detect early lung cancer, actually an incidental finding in about 23% of 2,191 participants is that there was at least radiographic bronchiectasis seen on the imaging studies. But to put this disease in comparison, for every one patient with bronchiectasis, there's approximately 20 with COPD. But obviously, this disease is much less common than COPD, but it's significantly more common than cystic fibrosis related bronchiectasis. So here's a visual that I like to share with patients to help them understand what's going on in their lungs. You can see here on the left-hand panel illustration of what a normal airway looks like, and then what an airway with bronchiectasis appears with the thick mucus, an enlargement of the diameter of the bronchus, and just a generalized inflammation that's seen in the airways.